Let me see my screen. Can you see my screen?
Yes, we can see.
Perfect. So, hello, my name is Henrick Durce, and I am an undergraduate studying psychology at the University of Montreal, in Canada, more specifically in Quebec. I'm also currently working as a research assistant at the Innovation, Technology, and Cognition Laboratory based in the same university. And I work under the supervision of Dr. Alexander Moreno, who's also the director of the laboratory and was also a speaker 2 days ago. So today I'll be presenting a systematic review of the literature that we have done on the topic of transdisciplinary expertise improves the development of gerontechnologies to support home living in community-dwelling older adults and family caregivers. And our work reviews the literature published from 2016 to 2021. And now for a quick overview of the presentation, I'll first begin with the introduction. Then we'll go over the objectives, the methods, results, and finally the conclusions. So a pretty standard approach. And throughout the presentation, I may sometimes refer to some terms such as CDOA and FC. The former stands for Community Dwelling Older Adults, and the later stands for Family Caregiver. Now for a bit of context. In the last couple of years, there's been a surge in the price of nursing homes and formal care, and this increase in price coupled with the desire of most older adults to age at home encouraged the increase in gerontechnology usage. And this has been supported by recent censuses done in the US in 2010, and then done in Taiwan in 2011. However, in Canada, it has been found that even if most people with disabilities use some sort of technology, there's a big proportion of them that report experiencing unmet needs for technologies in general. And thus, there are many reasons for older adults to start using technologies in their everyday life. Specifically, aging at home can sometimes prove itself very difficult to do, as most of us know by now. And with the upcoming of the COVID-19 pandemic, we saw that elders' technology use increased significantly in order to help them with communication, with healthcare delivery, or even with home support in general. And with this increase in the interest of gerontechnology use, it's now more important than ever to update our knowledge on the latest technologies to help CDOAs and their family caregivers age in place. And it's also very important to explore the different specialists who help develop and test these technologies. And this is what this study aims to provide. So it aims to provide a sort of comprehensive description of evidence-based technologies used by community-dwelling older adults without neurocognitive disorders and their family caregivers, and it also aims to explore the specific transdisciplinary contributions in the implementation of these technologies. So in general, it aims to identify some gaps in the current research and current technology development and implementation. Now for the methods, I'll first begin with the inclusion criteria of this systematic review. And at first we had literature addressing the use of technology-assisted home care in community-dwelling older adults and their family caregivers. So this was our primary criteria. Then the included works had to be research articles, so either case reports or group studies. They had to be available in English, French, Chinese, or Spanish. And they had to respect a qualitative, quantitative, or mixed design. And finally, they had to be published from 2016 to 2021, as I mentioned previously. Now to go even further, so here's the prisma flow diagram if you're interested in that. The study first began with the collaboration of 2 librarians specialized in geriatrics and psychology, who identified a total of 2,120 references in 5 different databases. The databases were PsycInfo, Medline, CNIHL, Web of Science, and AgeLine. And the rest of the methodology was done via Covidence, and duplicates were then removed with the help of this tool. And a total of 1,441 articles were screened by 3 independent reviewers. And after the abstract and title screening, only 112 articles were advanced and were full text screened by 2 independent reviewers. And in the end, 13 articles met all the inclusion criteria, respected all the exclusion criteria, and the results were then extracted from these articles. And I'm not going to go in depth with the exclusion criteria, but the primary reason for exclusion was that the technology was often not tested in both older adults and family caregivers. Often it was only tested with one or the other, and that's it. Now for the results section. we began by first mapping out the country of origin of all 13 included articles. And we found out that most of the gerontechnologies came from the United States, unsurprisingly. But there's also a fair share that comes from European countries and Asian countries. Then we also looked at the publishing years of all the identified references, and we found a rising tendency that first began around 2018 and 2019, and that kept going on as the years passed. And this shows a growing interest in gerontechnology in general, which is a good news, very good news. Now for the dimensions targeted by the gerontechnologies included in the review, we can see that alarms placed first at 62%, which is a very high percentage. But it's mainly due to its definition, which is as soon as a technology could send a sort of alarm or a cue, or even a pop-up notification to a family caregiver or a formal caregiver, we check this functionality. So this dimension is considered as pretty broad, and it was often coupled with other functionalities such as environmental monitoring, for example. And now speaking of which, environmental monitoring placed second at 54%. This means that 54% of the technologies included in the review offered some kind of environmental monitoring. And for a good example of these functionalities, we had a case of a oven top automatic stopper. So if the older adult left the oven top on for too long, there's an automatic mechanism that would cut the power to prevent fire hazards. And there's also other environmental monitoring devices. I'll show one more right after this page. Then at third place, we had movement detection at 54%. For the movement detection, most of them were actually sensors that were placed near doors and windows to actually detect when the door or the window was closed or opened. And it gave an idea of if the older adult was in the room or not. Then in fourth place, we had social connections at 39%. We also had video calls at 31%. They're both pretty self-explanatory. We had health monitoring at 31%. At 23%, we had cameras, self-monitoring, and sleep monitoring. And finally, at 15%, we had others. So there's other functionalities that are not listed in the table. I'll show one good example right after this, this page of a good other functionality. So here's some of them. I got three that I actually took out from the studies directly. So the first one is Quiet Care, which is a system of sensors that are placed throughout the home of older adults. And they actually, they can detect some information, some environmental information, such as temperature, such as humidity, lighting. So they're pretty useful. And they're a good example for environmental monitoring in general. They were included in the Berridge, Chan, and Choi study in 2019. Then we had the ODP-MSS, which is a device, special device that actually it's an automatic device that gave the medicine for older adults. So it was automatic for them. And it was included in the Suzuki and Azigawa study in 2018. So this is a good example for the other functionalities, which I mentioned previously. And finally, we had the SSH, which is a very interesting, very integrative technology in general. But what's very important with this one is the health monitoring aspect. They included scales, blood pressure monitors. They also added glucometers for diabetic patients, for diabetic older adults. So this is a very good example for health monitoring in general. Now to continue, concerning the transdisciplinary collaboration involved in the studies, we found that the majority of studies included the collaboration of nurses at 54%, of computer scientists at 39%, of biomedical engineers at 31%, and so on and so forth. And in some cases, they also added industrial designers, program managers, and other disciplines. And we can see that there's a big and broad, diverse collaboration that are being used to make these technologies right now. This is great to develop more adapted technologies for older adults. And now, in conclusion, as we can see, as I mentioned, the collaboration of many different fields of expertise is almost systematically implemented and is then considered as a norm. However, most of the technologies tested in older adults and their family caregivers implemented only one or two functions at best. And this implies that there is a serious need to develop integrative, easy-to-use, and affordable technologies providing a unified solution for different needs for home support. And this also means This also means that current research should invest significantly more time in the development of integrative technologies. And with the help of transdisciplinarity, this can be done more easily while taking into account the experiences of many different fields and expertise. And now, before closing this presentation, I would also like to advertise a special issue. So you're probably already familiar with this, as Dr. Alexandre Moreno and Celia Couve probably mentioned it already. But if you're interested in participating in this special issue, which is about gerontechnologies for home support, please send an abstract before April 1st, and then submit your manuscript before September 1st, 2023. And here's the QR code if you're interested for more information about this special issue. So thank you very much for listening. I'm open for questions, and I also left the QR code at the top right corner if you're still interested for the special issue.
Thank you very much for an interesting presentation that shows the need for, let's say, integrated competencies around many disciplines. So, any questions from the audience, please? No, well, from the internet, I mean, anybody who wants to ask a question, please use the chat. Any questions from the panel as it concerns this presentation? Okay, well, let me ask a question. Okay, okay, let me ask a question then. The way I see it, indeed, we do have a lot of competencies from, say, various scientific domains. I think that the one thing you did is that you broke up a lot the competencies. For example, we have computer scientists, machine learning people, and so on. So I guess we have in general the medical devices, the biomedical engineering, the informatics community, the computer science. But what is important in the end, as far as I can understand, is the APIs and the involvement of the users. And I think this is the one thing we need to make sure that this integrated care can achieve. And I think this is the barrier we have as it concerns this universal platform you are alluding to. So how far are we in this particular effort to achieve a universal platform? I mean, with all those different profiles of users and all these different profiles of patients?
This is actually a very great questions. I could not even answer it right now. For the collaboration, there's for more integrative technologies, as you mentioned, there's very different expertise that are collaborating to actually come up with more integrative platforms, as you mentioned. But in this systematic review, we did not really, we actually did not have, like you said, an API, or I don't know exactly what you meant by that. I'm very sorry. But it was more like technologies more applied physically to support older people. I don't know if this answers the...
API is all about the communication, let's say, interfacing with the user, okay? So,
oh, yeah.
So the profile of the users. And we all know we have diverse profiles. So that is the one thing I think our technologies have to seek, okay? I mean, APIs that are usable, okay, that are intuitive. So let's say that's the question about, okay?
Well, I think we're actually getting pretty close to it. There's actually one study in the review that kind of did this. It was about it's a sort of mHealth device that actually did some sort of this many profile, like you said, that are included in this in the application. So I think we're getting pretty close, but there's still a lot of advances to make, in my opinion.
Okay, thank you very much.